That was the first article I found very interesting from clinical standpoint. Now the second article in the section of geriatric psychiatry, this was published in Journal of Clinical Psychiatry in 2023. Now, this was mainly to look at the treatment of NPS, Neuropsychiatric Symptoms of Dementia, using THC, tetrahydrocannabinol, mainly the dispensary-obtained THC. Well, we all know how difficult this is, right? Neuropsychiatric symptoms management in dementia. Management options are limited for sure. Antipsychotics are used often, but they all carry a significant side effect burden, mainly that black box warning of sudden cardiac death in elderly, which always bothers me when we have to go to that option. But in the end, it's all about risk versus benefit. So THC is one of the novel options. And the reason I included this study was it was published in Journal of Clinical Psychiatry, which is a good journal. And you can see it's 2023, but their last issue was released by the end of 2023. So this was the most recent issue with this article published in that. So in United States, if a caregiver has to obtain THC, they have to go to a commercial dispensary. So I think it's a good thing because we can track that, right? And that is what the authors of this article did. They evaluated the efficacy of dispensary-obtained THC for patients with dementia having neuropsychiatric symptoms. NPS is neuropsychiatric symptoms. And two reviewers reviewed the chart. So it was not like a review study, reviewing the charts. But they found 50 patients with diagnosis of dementia between the year of 2017 and 2021 who were given or recommended dispensary-obtained THC. So there were two outcomes they looked at. Primary outcome was to look at the effectiveness of treating NPS, obviously. But secondary outcomes were to first look at something called uptake. Uptake is how many caregivers obtained and gave THC. So it's not just prescription that was sent, it was also the fact that they went and took it and gave THC. That was the uptake outcome. And the second was after THC was given, how did the antipsychotic use changed? And third was the adverse reaction. Obviously, we can't go just after benefit. We have to look at risk, right? It's all about risk versus benefit for us. Now, what did they found? So they found that out of 50, 38 obtained the dispensary from THC from the dispensary. So 76% had the uptake. And out of this 38, 30 who took it showed improvement, and this was based on the caregiver rating scale. So there was 79% improvement in the neuropsychiatric symptoms reported by caregiver. And it was mainly recommended for these symptoms: agitation, which is obviously high on the NPS list, aggression, irritability, lability, anxiety, and insomnia. And then among these 20 patients, now there were 20 patients who were taking antipsychotic at baseline. So they looked at these 20 patients who were taking antipsychotics at baseline and they took THC. Out of this 2012, which is 60%, were able to reduce or completely discontinue antipsychotic. I know the N is very low here, but interesting to see that 60% showed that reduction in the antipsychotic use. But what were the adverse reactions? We can't ignore this part because there is so much going in the THC space right now. The main side effect was dizziness, worsening of agitation. Now this was interesting, right? We are mainly going after agitation, but these patients had worsening of agitation. I was not able to get full study, so I was not sure how many had worsening of agitation, but few had worsening of paranoia. Well, we all know that with THC, paranoia psychosis is a possibility. Now, the important point is 2 caregivers said the side effects were to the point that they have to discontinue the treatment. I'm assuming it was paranoia or agitation, but I don't know exactly what were the reasons for that. But authors concluded that some patients, some subset of dementia patients with NPS may respond well to THC and may reduce the requirement for antipsychotics. So this is, I think, very good study for future studies to do more study at a larger scale, in my opinion. But I have patients with very severe NPS where medications are not showing response, or there are so much high medical comorbidities that the medicines are doing more harm than benefit. I think in those cases, this is a good option. But let me know if you have seen the good response of THC for the neuropsychiatric symptoms of the dementia. And you all know that we have a full section on geriatric psychiatry, on neurocognitive disorders, where I have done many chapters. But recently I was fortunate enough to have Dr. Anderson Chen talk to us about the treatment update, the most recent update for management of behavioral and psychological symptoms in dementia. I think this study may be an add-on to his update that he gave. Please watch that if you have not already done. This is in our geriatric psychiatry section. So this was the article number 2 I found to be of benefit for our daily clinical practice.